Some of the more common questions I get from my patients revolve around what can they be doing to have a healthy prostate, what lifestyle improvements can be made, how should they be eating, and if there are any supplements they should be taking. Today, I am very excited to host on the Prostate Health Podcast today one of the primary thought leaders in the study of benign prostate disease. He'll get us up to speed, including what we can be doing to help implement more of a prostate-healthy lifestyle. You don't want to miss this one. So the big question is this: how can men and those who care for them better educate themselves regarding prostate health, the conditions that affect the prostate, and the latest technology in managing these conditions? That is the question, and this podcast will provide the answers. On a weekly basis, we will be chatting with experts, innovators, and leaders in the field of urology, sharing useful information with the general public to improve their lives and increase their overall health. My name is Dr. Garrett Pohlman, and welcome to the Prostate Health Podcast. Prostate Health Podcast is for informational purposes only. Nothing in this podcast should be construed as medical advice. By listening to the podcast, no physician-patient relationship has been formed. For more information and counseling, you must contact your personal physician or urologist with questions about your unique situation. Today, I am very excited to have Dr. Dr. Kaplan here to chat on the Prostate Health Podcast. Dr. Kaplan is director of the Men's Wellness Program at Mount Sinai Medical Center. He is an internationally renowned authority and one of the primary thought leaders in the study of benign prostate disease, the association of metabolic factors with voiding dysfunction, and with symptoms related to both benign prostate enlargement and bladder function. He has over 1,000 publications, including 600 peer-reviewed articles and 90 book chapters. His landmark study, published in JAMA in 2006, changed the way medications are used in the treatment of men with symptoms related to both benign prostate enlargement and bladder dysfunction. He has made over 340 presentations in more than 35 countries. He is the co-author of 5 books and is on the editorial board of numerous journals, including Urology, Journal of Urology, and Urology Times. I've really enjoyed following his literature. In fact, I would like to give him credit as his recent article in the Urology Times, Demystifying Less Invasive Solutions for BPH, served as inspiration for episode 45 here on the Prostate Health Podcast, where we reviewed various minimally invasive options for BPH. Dr. Kaplan, welcome to the Prostate Health Podcast.
Thanks for the invite.
Now, I'm the first to admit that when it comes to discussing BPH or enlargement of the prostate, it is much easier to get excited about focusing on all of the new and minimally invasive options that urologists now have in helping men with BPH. I think what often gets overlooked, or at least is not talked about as much at times, is how diet and exercise can play a role in the disease. Now, when it comes to men's health, what would you say is the biggest health crisis today in our country?
Well, it's frankly, other than COVID, which is affecting everybody, it's actually the biggest crisis for men and women is obesity. It is going at the end of the day to make cigarette smoking look like a weekend compared to the enormous impact that obesity has. And it has so many downstream consequences, as we're beginning to learn. And I think the other part in terms of a crisis is really the lack of knowledge or the misinformation that's out there. And I think we've learned in all aspects of our life that people are seeking information from unreliable sources, and that's not helping as well. So we're also in this zone of or era of cyberchondria. So the combination of misinformation, lack of information, and unfortunately lifestyle in the United States and the Western world, which contribute to increased weight, lack of exercise, are part of a constellation of issues that both men and women are going to have to deal with.
Yeah. No, certainly. And so is there any association between obesity or the metabolic syndrome and urinary symptoms?
Oh, for sure. So again, we're focusing here on men, but there has been, traditionally we used to, at least when I was training, men were heavier, were thought to have smaller prostates, and that doesn't seem to be true. And there's a variety of factors, but one would play, at least hypothetically, and I think there's a lot of data to support it, that obesity contributes to a hyperinflammatory state within our bodies. And that's not just true in our prostate. That's true for a lot of issues. And that contributes to probably some degree of enlargement, certainly some degree of overactive bladder. We know that in women, the biggest risk factor for overactive bladder symptoms is not age and it's not multiparity. It's actually obesity, central obesity. That comes from elegant work from the Boston area community hospital studies. So the same in men. And that also has sleep apnea, which can also contribute to a lot of urinating symptoms. So we're not just a prostate, we're not just a bladder. Everything kind of harkens together and superimpose things like diabetes, which can have its own effect on urinary symptoms and directly on the bladder, and hypermetabolic states such as cardiovascular disease. So obesity is probably the unifying factor in all of it, but it's a major factor.
And from your research, what impact have you seen weight loss have improving urinary symptoms?
So we've done some preliminary work that demonstrated that people, and there was again, not a large study, that when people lost about 2.5 inches off their waist, 2 to 2.5 inches of their waist, they noticed a difference. So I'm not big on the weight. I'm much more big on central obesity. And there have been other studies as well. What that number is, I can't really, I wouldn't say, well, lose 10 pounds or lose 2 inches or things like that. But certainly less weight's better than more weight. I think we can all agree on that. What the magic number is depends where you start. So I think it's probably the percentage of loss as opposed to an absolute number.
Now, for our listeners, in addition to the increased risk of heart disease, what other negative effects does obesity have on men's health?
Well, certainly sexual health, pelvic pain, libido. So, if you look at the factors that men seek consultation for, let's just say above the age of 50, 3 of them are related, 3 of the top 10 are related to what we classically term as urologic issues. 1 is urinating problems. 2 is sexual function problems, be it erectile and or testosterone issues. And 3 is screening for prostate cancer. So we are, in a certain sense, I wouldn't necessarily call us the quarterback, but certainly we are in the coaching front, because a big part of this is the opportunity to coach people and intervene early. So as you said at the outset, we focus so much on the end game when we forget to focus on the pregame. And really the pregame is where the money is and where the future is. And as we go into future and leveraging technologies in the future, I think that's where people are going to go. Again, a little bit offside, but being involved also on the entrepreneurial side and looking at things in the future, it is clear, and big hospitals may not want to hear this, that the future is the consumer. The consumer is going to drive healthcare. They're going to drive healthcare. They're going to drive healthcare choices, and big hospitals are going to have to adapt. And frankly, it really allows for the speedboats and the entrepreneurs to really change the context of healthcare. We saw this from COVID, that how much virtual care, telecare became a big part of the way we take care of patients, and patients like it. And I think being able to transmit that information earlier on in the game to patients so they understand the role of diet, they understand the role of exercise, they understand the role of stress. And these all play a role in our general well-being. And urinating is part of general well-being. And often we silo all these things. And that's the way we've been trained. But that's going to change. And for those of the people more in your era, you're a little younger than I am, that's the opportunity as well.
Well, I really appreciate that perspective. And now we touched a little bit, we talked about the impact that weight loss has, and maybe this kind of ties together, but when looking at exercise, can this alone help improve bothersome urinary symptoms as well? Oh,
sure, because, there's this general sense of well-being, and that's important as well, because we train ourselves in a certain way, and our bladders, therefore, and one would argue also for bowel movements, to sometimes run at earlier volumes. So a big part of this is learned behavior. So it's not just what the bladder is, because and everybody listening here knows that you can have 2 men and the same age and the same size prostate, and one has miserable urinating symptoms and one doesn't. So there's a lot of other factors. Somebody may have trained differently. Somebody may be under more stress. Somebody may be heavier. Somebody may be lighter. So it's not just prostate size. And unfortunately, we kind of, frankly, dumb it down. And I think the opportunity is to really heighten our awareness and heighten patients' awareness to deliver what I think is a better outcome. And when we talk about personalized care, and I think we throw that term around, but we have the ability to personalize care and to actually specify information for each individual patient. And that really, to me, is where the opportunities lie.
Now, when men ask you about exercise and maybe how much they should be exercising and to what extent, how do you respond to that question?
Well, I say you got to start. So I don't say you got to, do X, Y, and Z, but, each week or 2, try to increase that. We're not trying to create superstar athletes here. What we're trying to do is get people off their seats, so to speak. And, usually if a person at least 3 times a week is doing about an hour of exercise, and that could be, frankly, a brisk walk, it can be cycling, it can be whatever they like to do. So some folks, unfortunately, take it to an extreme right away and obviously you're going to pull a lot of things if you haven't used certain parts of your body. So you got to be a little bit careful of that. But I usually encourage about at least an hour 3 times a week and gradually increase it to many days as possible. Once it becomes part of your routine, you don't think of it as, oh, I got to exercise for now. You think of, I eat, I drink, I sleep, I exercise. It becomes part of your normal regimen.
And now when it comes to the type of diet or just diet in general, what are your recommendations regarding diet for a healthy prostate?
Well, what I tell people is what's good for your body is probably good for your prostate. And I've been a vegetarian for about a decade. I intermittently will eat fish, but I haven't eaten meat in years. So for me, that works. I think the thing that we can all agree on, whether you eat meat or how much you do, is the processed food. And I think a very high processed food diet is a hyper-inflammatory diet. And that creates a lot of problems across all spectra of your body, much less your prostate. So it's something that I encourage. A lot of the processed food is just bad. There's a reason why it's done economically from the food company perspective, because they want to store it. But all those preservatives are just not good for you. And you'll notice that if you eliminate that, you're going to feel better. I mean, I know this on a personal level because I've had my own weight struggles throughout my life. I used to weigh 300 pounds when I was 15 years old. So I'm always trying to figure out the right thing. But I can tell you for sure that if you eliminate a lot of the high sugar, high carbohydrate type of processed food and take more of, and a plant diet's very, very hard. I mean, I've seen people try it and it works. It's just very difficult to maintain. But if you have fruits and vegetables and green stuff, that's actually good. If you throw a steak once in a while, it's probably okay. I personally haven't, but I think that's the most important thing. If it's processed, try to stay away from it. And that's true across all boards. We talk a little bit about caffeine. Caffeine has pros and cons to it. Certainly caffeine will irritate your bladder, if nothing else. Alcohol, kind of the same thing. I drink wine. I don't drink alcohol, but certainly if you moderate. So that's the key things. Moderation, as well as staying away from processed food. The processed food, it's amazing how not good for you it is. I know it's not great English, but it just has deleterious effects on virtually every part of your body. And if you look at the literature and other aspects besides urology, they all say the same thing. Whether you look at the endocrine literature or you look at the cardiovascular literature, it doesn't make a difference because the end affects everything in virtually the same way. It's really a hyper-inflammatory response in your body. You want to kind of reduce that.
And so, I'm sure some patients come in and say, well, which, is the keto the best? Is intermittent fasting the best? So there's probably really no best diet as long as you're kind of following some of those key principles that you mentioned, right?
And you also, and I would agree with that. I think the thing is you have to be doing something that's sustainable. When people do these crash diets, they'll lose weight. The problem is you can't maintain it. And if you can't maintain it, it's not a good idea. So you have to do something that is going to be replicated throughout your life, because then you're just bouncing up and down. And that's the yo-yo dieters, because a single diet doesn't work. A lifestyle change, and that takes commitment, and that takes work, and that takes effort, and that's not easy. And that's what people have to do. It's very interesting. If you look at behavior changes, what really makes a difference is the patient believing that they can do that behavior, but just as importantly, that behavior needs to be reinforced. And that's not what happens with any of these things. So there are a lot of technologies that can actually do that, and leveraging that technology to reinforce that personalized behavior will help actually maintenance and sustaining the lifestyle changes that we want.
From a prevention standpoint, is there anything a man can do to prevent the development of symptoms of an enlarged prostate or BPH?
Well, notwithstanding some of the stuff we've taken, men are to varying degree destined to have a larger prostate when they're 50 than when they were at puberty, when they entered puberty. And that's just the way it is. Some more, some less. There's genetics, and that also plays a role. So I think the thing to do is to start developing those habits earlier on. I can't say you're going to prevent all of this, but you can certainly have that, early, at least awareness. And I think that's where the opportunities lie, to really engage patients, and in this case, men, because as you know, men engage the healthcare system anywhere from 25 to 30% less than women do. So the earlier they're engaged in language that they can do. So a guy in their 20s and 30s, they get the exercise, and they're going to be cool with that. They're going to do it. Somebody who's 60, who's never really exercised, that's a different conversation because they haven't done it. So the earlier we talk about those things, and I think that the younger generation, maybe your generation, millennials, 30s and 40s, are, I think, a little bit more educated and more aware of these types of things. But superimposed on that is a layer of stress we've not really seen yet. Your generation is going through enormous amounts of stress. When my parents raised me and my brother, the goal was that we were going to do better than they were. And that was the expectation, and that's actually usually what happened. But in your generation and my kids and people, the kids of your era, can they do better than their parents? And it's a different world because it's so competitive. And that layer of stress, which is really not emphasized a lot in advertisements for Urolift and Resume and Aquablation, really has a major effect. Stress affects a lot of different parts, but certainly urinating. We've seen that. We know that. So engaging on those conversations is also going to be part of how we frankly do business in terms of making patients, if you will, urinate.
So you probably get this a lot in your practice as well, but I bet at least once or twice a week I will have a patient ask me about a supplement they've heard or seen on, advertised for the prostate, and, they want to know if they should be taking this or not. When you get this question, how do you typically respond? And, are there any supplements that work for BPH?
So for those who have actually either met me or read my work, you know that I drip with sarcasm often. So my usually comment is the people who benefit the most from supplements are the people who sell them. And, if something helps, that's fine. The people who benefit the most from supplements are the people who don't eat anything, frankly. So is it a kind of a placebo feel-good effect? Sure. But if they feel better, great. So, is there some data that things like salt palmetto do have some side effects that have not been talked about? The answer is yes. How much? We don't know because the studies are not, very well done. And there's so many different preparations and in so many different populations. But it's not that I'm against supplements. I just think that I can't really say that they have a real therapeutic effect above placebo.
So Dr. Kaplan, you are definitely one of the primary thought leaders in the study of benign prostate disease. In your opinion, what does the future hold with respect to clinical science development for benign enlargement of the prostate?
So people, frankly, have focused on treatments because that's where the money is. And I kind of get that. And there'll be other treatments in the minimally invasive space. There'll be probably some variations in the surgical space. I think medications, I'm not sure if we've hit our ceiling yet. There are some other targets that are being looked at. Would they be quantitatively different than what we have? I'm not so sure. So I think on the therapeutic side, I'm not sure how much, again, in the minimally invasive side, there's a lot of things coming out. I'm the primary investigator for a technology that uses balloons and paclitaxel, which is having some terrific early results, but we'll have to see. There are some stents and things like that. So there's going to be a lot in that space. I think diagnostics is really the place to be if I were going to spend a lot of time, particularly remote diagnostics. So for those who are interested in this space, the future is remote. And we know that there is a remote uroflows you can do. There's a couple of companies that are involved in that. And they're kind of interesting because they do actually provide some data. The ability to do probably some pelvic ultrasound. Patients can probably take their own image with some type of instrument they can hold in their hand and then transmit that through a wearable. So I think that's really where the important things are coming on in the future, because a good portion of our patients are no longer going to come into the office. They're going to be seen remotely. So being able to engage on multiple levels, including therapeutic advice, will be very, very helpful.
Well, Dr. Kaplan, any final thoughts today for our listeners?
It's kind of interesting as we, they speak to fellows and residents and some of the, frankly, your age group. I always say the same thing. They look at me like I'm nuts, that this is the greatest time to be in medicine from every perspective. The opportunities are enormous, and it's really a great time to be. I almost wish I could be starting again, because technology has not really been leveraged well in the delivery of better care to patients. It's been done with respect to robots and lasers, but those are kind of variations of a theme. But being able to better diagnose, earlier intervene, efficiencies is going to be important. For example, I don't understand why there's a waiting room. To me, a waiting room makes no sense. In 2021, that's just a waste of time, a waste of space, a waste of money, and really inefficient. So things like that are going to change, and that changes a lot, and it scares people. But I look at this as those who lead and take the opportunity to lead will really change things. And as I said at the outset, what's going to determine healthcare is not the big hospitals and the big centers. They're the Titanics. Well, I would say the ocean liners. I don't want to say Titanics, but they're the ocean liners. They're hard to move. It's going to be consumer driven, and consumers want access, easy access, affordability, Those are the two most important things they're going to want, whether it comes from New York Presbyterian or Nebraska or California. It doesn't make a difference. They want it easy, they want it quick, and they want it cheap. And leveraging the technology will help with all of that.
Well, I think I can speak on behalf of all of our listeners that we really appreciate you taking time out of your busy schedule to join us today on the Prostate Health Podcast. Definitely valuable information that will really help empower our listeners as they navigate their prostate journey. And thank you again for chatting with us today on the podcast.
No, thanks so much for inviting me. Thank you.
Thank you again for listening to the Prostate Health Podcast. We would love to have you join our podcast Facebook group at www.facebook.com/groups/prostate health podcast, or just use the Facebook group search function and search for the Prostate Health Podcast and ask to join. We'll see you at the next episode.